very good afternoon to each and every one of you. Thank you so much for joining us. I am Dr. Eva from Oraliah Dental Clinics. The topic for today's live session is whether or not we require a crown after a root canal treatment. So it is a very common question that is asked to us day in and day out in our practice. Almost everyone that goes through this procedure has required to go through a root canal or a crown will ask us this question that can I go a certain time period without getting a crown done after the root canal? Can I skip it completely and not get a crown done at all after the root canal? So these are very common questions, and it's a very valid doubt to have. These are very valid questions to have. We are here today to address this. We're here today to address these doubts. And hopefully by the end of the session we can completely eliminate these doubts that you have and make you believe that crowns are very beneficial for your teeth in the long run after the root canal, and there is a proper scientific basis to it. Your dentist is not scamming you. It is backed by scientific literature. One of the most common reasons, which is the most important reasons your dentist has told you to do so, to get a crown after a root canal, is to protect your tooth from further damage and to reinforce the tooth structure. To understand these two statements, that we have to understand why do we need the root canal in the first place, and what exactly happens during the root canal, what is the aftermath of the root canal. So why do we need the root canal in the first place? Teeth have nervous tissue inside of them. Nerves are present inside your tooth, and they can get damaged due to a number of reasons. It could be because of bacteria in the form of decay, it could be because of cracks, or it could be because of any kind of trauma to the tooth wear even. So this kind of damage leads to irreversible inflammation in your pulp, in your nerve tissue, and the only treatment for that is that we need to remove that nerve tissue. We need to disinfect and clean the entire area and put a filling there which is inert and doesn't react with the tissue present there. This is the basis of the root canal treatment, that your nerves are inflamed and before they cause you pain, they need to be disinfected. So for doing that, to gain access to these nerves, to remove them, to disinfect them, we need to remove a certain portion of your tooth structure. Suppose there is decay present before doing this, then the dentist also needs to remove that decay to ensure that there are none of the contaminants are left behind. And so if you can make out the tooth structure that is there before and after the root canal treatment, it is slightly different. A little bit of tooth portion is lost after the root canal treatment, and it is inevitable. Not much can be done about it, though we try to be as conservative as possible in our treatments. And so the strength of the tooth is slightly lost. It is slightly decreased after the root canal treatment. Also, because you've removed the nerves from the tooth, it becomes a hollow structure, it becomes little brittle, it becomes fragile. So there are chances of tooth fracture after the root canal treatment if you don't reinforce it with a structure such as crown. There are different high strength crowns available these days which can really compensate for the loss of the tooth structure that has happened during the root canal, such as metal ceramic crowns or full ceramic crowns. Full ceramic crowns such as zirconia. Zirconia is a type of full ceramic crowns, can be 10 times more stronger than the tooth enamel, and it can really help reinforce that tooth structure that became a little weakened because of the root canal treatment. Another thing that happens during the root canal treatment is you lose that sensory nerve supply in that tooth, because we've removed the nerves, we've cleaned that area. So it is the technical term for this is proprioceptive impulse. That proprioceptive impulse is lost in that tooth. It is diminished. So you don't know exactly how hard to bite. You cannot gauge the force of your bite, and you might end up biting something a little too hard and you will not realize it, and that can again lead to your tooth fracturing or loss of that tooth, cracking it up. So that kind of protection from further damage after the root canal, that kind of reinforcement is really important after your root canal is completed. Another one of the very important reasons that a crown might be indicated is to restore your natural tooth color, to keep your natural tooth color intact. If you get a root canal treatment done, during the course of time there might be slight discoloration of that tooth. This can happen because of byproducts of the chemicals that we use during the root canal. This can also happen because of the loss of nerve from that root canal. It can lead to a dullish greyish appearance of that tooth, which is slightly anesthetic if you think about it, especially in the anterior tooth region, especially in the front tooth region if this happens. So these days these days crowns are available they're very aesthetic. They match the tooth structure very well, and it's really hard to discern which one is your natural tooth, which one is your artificial tooth. There are different layering techniques. There are different degrees of translucency can be given according to your natural tooth that are present. And so this is another one of the most important reasons to restore your smile, to restore the aesthetics of your smile. And another important reason that this might be indicated, a crown is indicated, is to prevent any sort of recontamination after your root canal. So bacteria, right? Bacteria can creep into seep into very small spaces. They can especially if the restoration has not been done properly, they can enter through small spaces and reinfect that area again. So to provide a 360-degree coverage, to provide a full coverage, a crown can be given so that we can prevent any kind of harmful leakage that's happening from your oral environment to your roots of your tooth, and this will prevent reinfections. A lot of studies have been done on this, a lot of research has been done on this, and they have come to the conclusion that your quality of your root canal can still go a little here and there, but the quality of the crown that you give later on, the quality of the restoration that you give on top of the tooth, it really determines the success and the failure of the root canal treatment. So yeah, these are the main important points why a crown might be indicated to you after a root canal treatment. It is beneficial for you in the long run. It increases the longevity of your tooth significantly, and it protects the tooth structure from further damage. It increases the fracture resistance of the tooth. You can eat and chew easily on that from that side without fearing any kind of fracture or any kind of problem there, and it will reinforce it. It will provide that strength, compensate for that strength that was lost during the root canal. It will prevent any kind of reinfection, and it will also restore the smile. It will also restore the tooth color that might have been changed, and at the end of the day, it is revitalizing your smile. Apart from that, that's it. That's more or less of what is there. Why crowns are important after a root canal. Your back teeth almost always require a crown after a root canal. Your front teeth maybe in certain cases they might not. But if there is significant loss of tooth structure after that, after the root canal, or if there is a certain color change that might have happened, then your front teeth also require a crown after the root canal. I hope this has been insightful in a certain way. I hope this has been a little knowledgeable, and the next time, though hopefully not, whenever you go to your dentist and you need a root canal and a crown, and you ask for a crown yourself, and because you understand that how beneficial it is to you and how it increases the longevity of your tooth. It helps restore the function of your tooth. You can eat and chew properly. And if there are any questions that are there, if you have any doubts regarding the type of crowns that are available, if the costing of each crown and pros and cons of each kind of crown, you can always send us a message. You can always leave us a comment, and you can always call us at Oraliah Dental, and we can help you out with the kind of crowns available and what is the best option for you. Yeah, that's it. That's all from Oraliah Dental about crowns today. Are there any questions?
Scroll to the side, questions.
Oh, okay.
Yeah.
So first question that we have is that whether which is a better crown? Is it a metal ceramic or a full ceramic? So this really depends on the it's different from it's subject to different from case to case. If you don't keep cost as a factor, then full ceramic is obviously better than the metal ceramic one, because it provides superior aesthetics compared to the metal ceramic. The metal ceramic will have a slight metal line in the lower part of the tooth, and if your gum recedes, then that metal line might be visible. Strength wise, both of them are equal, both of them are pretty great. If it's your posterior tooth and if it's your if cost is a concern, then you can always go for a metal ceramic crown. But if it's your front tooth, then I would consider the full ceramic crowns to be better in every way possible. So next question is how many days or months I need to wait after RCT to get a crown, and what happens if there is a delay. So after the RCT, if you're feeling fine, all the symptoms are done with, and you're able to eat from that area properly, then you can get a crown immediately. There is no problem in getting that crown immediately, and try not to delay this crown after the root canal, because again, the same old thing that I told in the whole of the webinar, that what if the tooth gets fractured, the strength of the tooth is slightly decreased, and it's just better to get it done. But at the same time, just ensure that the tooth is symptom free. I have the next question is that I have pain on the tooth after the crown is done, and why is it so? So transient pain might be there 1 or 2 days after the crown is being fitted. That is very transient. That can easily be healed with after taking some anti-inflammatories or some painkiller. Some pressure might be there because of the crown, because it's a new structure in your tooth. So some increased pressure might be there in the tooth, and that's why a little bit pain might be there. Also, at the same time, if you're still feeling that there is some adjustment issues and you're not able to bite properly from that side, and that is why you're getting the pain, then you need to visit your dentist and get that adjusted, because a little bit of high points or something can also cause pain and increase pressure on the tooth. How long does the crown last? The crown can last with proper maintenance, proper brushing, proper flossing, keeping the gums in that area clean, and not letting bacteria come in that area again. It can last for up to 15 to 20 years. A lot of companies give good warranties with these crowns, and it can last with proper maintenance and proper care. It can last for quite a long time. That's it. Thank you. That's it from Oraliah Dental today. I hope this session was insightful, and I hope you gained some knowledge about the topic.